Assalamu alaikum students. Students, in this video, I will present you some important medical terms used in the renal physiology. As you concerned with the physiology of the urinary system, you should have to know about these important terms. These medical terms have clinical importance. So let's start. Number one is the renal. Renal is a Latin word. Its meaning is related to the kidney. Related to the kidney. The medical term is used renal. Then the nephron, structural and the functional unit of the kidney, is called the nephron. It has glomerulus, Bowman capsule, including loop of Henle. So the nephron is the structural and the functional unit of the kidney. Diuresis. It is another medical term used in the renal physiology. Diuresis. Its meaning is increased production of the urine or excess production of the urine. Then the nephritis. Inflammation of the kidney is called the nephritis. Inflammation of the glomerulus tubules or renal tissue can also be termed as the nephritis. It is due to the infections. Then the nephrosis. Nephrosis is any degenerative disease of the kidney tubules is called the nephrosis. In this case, protein pass into the urine. Pyelonephritis. Pyelonephritis is the inflammation of the kidney due to the bacterial infection. It is basically urinary tract infection where one or both kidneys become infected. Then the uremia. Uremia is a condition in which there is high level of urea in the blood, due to the excess of amino acid metabolism. So this is the term mostly used in renal physiology, uremia. Azotemia. Azotemia is high nitrogen containing compounds in the blood. Azotemia is a condition in which the high concentration of the nitrogen containing compounds such as urea, creatinine in the blood are present. Then the renal glycosuria. Glycosuria is the excretion of glucose in the urine. Normally, there is no glucose in the urine because all the glucose is reabsorbed into the bloodstream. Hematuria. Hematuria. Presence of the blood in the urine is called the hematuria. It may be due to the infection. Hemoglobinemia. Hemoglobinemia is the medical term used for the presence of the free hemoglobin in the urine. It is caused by the breakdown of the RBCs during the transfusion reactions. Then the pyuria. Pyuria is the medical term used for the presence of the pus in the urine, typically from the bacterial infection. Then the dysuria. Painful or difficult urination is medically termed as the dysuria. Then the polyuria. A condition of frequent urination is called the polyuria. In it, body urinates more than normal and passes excess or large volume of the urine at a time, which may be more than 400 ml. It is mostly seen in the diabetic patients. Then the oliguria. Oliguria is a condition in which the small volume of the urine at a time is excreted out. When the body urinates less than 400 ml per day in adults, this is called the oliguria. Then the anuria. Anuria is the condition in which kidney fails to produce urine or complete suppression or shutdown of the urine flow is called the anuria. Then the nocturia. Nocturia is excess urination at night called the nocturia. It is due to the high fluid intake. If one takes high water content, it may suffer from the excess urination at night. Then the melituria. Melituria is the medical term used for the presence of any sugar in the urine. So these all are the medical terms used for the renal physiology study. These terms have clinical importance in the clinical aspect of the urinary system. Thank you very much.